Hi, I'm sure you've heard about the classical signs of diabetes, which is excessive thirst, excessive urination, and frequent hunger. The question is, what happens in the body that makes you want to drink water almost every time, especially at night, or makes you want to urinate consistently, like every 5 minutes you want to use the loo? Why? In this short video, I'm going to do my best to explain it. Now, remember we mentioned that the body functions in a state of balance, which is homeostasis. We don't want anything to be too high or too low. In diabetes, insulin doesn't function properly, such that the cells do not respond to the action of insulin. Insulin is supposed to go tell the cells, knock, 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 I'm here, open up. And when the cells open up, glucose is moved from the bloodstream to the cells, but insulin is not there to do that work, so all the glucose are concentrated in your bloodstream, and it's very, very dangerous. Now the kidneys try to compensate for this defect because they all work together. The kidneys don't want to die so it steps up and says, what can I do to reduce the glucose in the blood? So it says, I can help excrete it via urine. So you start urinating consistently, which is the result, which is why you notice that you're always going to pee, especially at night. But the kidneys cannot excrete just glucose crystal. So as the glucose is being excreted, fluids, water is also going out, which is why you're very thirsty. Because when your fluid volume drops, the body starts screaming, we need water, we need water, we need water. So you start drinking water. It's that simple, right? Then we talk about excessive hunger. Remember, diabetes affects every cell in your body. So the brain cells are not left out of this saga. So the brain cells are starved because there's no food in your brain. Glucose is filled in your blood, but there's nothing in the cells of your brain and every other cell that needs it. Once the brain cells are starved of the glucose they need, the brain is triggered to make you want to eat, because in the mind you need glucose, right? But they don't know that you have excess glucose in your blood. It's just that insulin is not doing what it's supposed to do. So you're triggered to eat, which is why you go on to eat, and you eat, the vicious cycle continues. You eat, the food is converted to glucose, glucose is concentrated in your blood because insulin cannot do the job and say, hey cells, open up and receive glucose. It sounds very common, but it's a dangerous process. If nothing is done to reverse it, it can go on to cause retinopathy, which is damage to your retina, and it's the leading cause of blindness worldwide. So diabetes is a big deal, which is why at the Diabetes Care Network we've made it our mission to bridge the knowledge gap in the management of type 2 diabetes. So yesterday I made a post about lifestyle modification being the primary focus of managing chronic condition. The truth is, if you're pre-diabetic and you go see your doctor, he's going to tell you to either lose weight or go talk to a dietitian and review your diet, then come back after 2 weeks for review. Why is he saying that? It is because every guideline recognizes the place of non-pharmacological approach to the management of chronic conditions like diabetes and hypertension. Non-pharmacologic approach simply means using lifestyle changes devoid of chemicals or medicines in achieving consistent blood sugar control or managing your blood pressure. Now, if every guideline recognizes the importance of lifestyle changes, why do you think you want to be on medication for a very long time when you have an alternative? You cannot out-medicate yourself from a bad lifestyle. It's that simple. So if you feel you can take drugs consistently for the rest of your life without doing or having a rethink or assessing how your lifestyle could be negatively impacting on your blood sugar control, then you need to sit down and count the cost, because it's troublesome.